Welcome to the Health Headliner podcast by Tudu Digital. Our content is informational only and not medical advice. Please consult your provider. Now, let's dive into today's headlines.
Have you ever noticed how some babies just seem, a little more sensitive right from the start? Like maybe they cry more easily or they're a bit harder to soothe?
Yeah, definitely. It makes you wonder, doesn't it? Like, is it just their personality or is there something else going on?
Right. Like, could it be something the mom was eating or doing while she was pregnant? Could that have an impact on their temperament later on?
Well, that's a fascinating question. And it turns out researchers at Oregon Health and Science University have been looking into exactly that.
Really? So in this deep dive, we're going to be talking about some pretty cool new research that explores a potential connection between a mother's diet during pregnancy and how her baby behaves emotionally in those first few months of life.
Exactly. I've got a recent health news article from Oregon Health and Science University, and they actually linked to the full scientific study, which was published in the journal Scientific Reports.
So what we're going to do is break down this research for you, highlight the key findings, what it all means, and try to do it without, getting too bogged down in all the technical jargon.
Sounds good. So let's start with what the researchers were actually trying to find out. Basically, they wanted to see if there was any relationship between what mothers ate during their pregnancies, specifically in the second and third trimesters, and the likelihood of their babies showing what they call negative affect in infancy.
Okay, so negative affect.
Yeah.
Does that basically mean like fussiness, being easily upset, just generally showing signs of distress, like that kind of baseline emotional state?
Yeah, you got it. They were looking at whether a mom's diet could be one of the things shaping that early emotional landscape.
Interesting. And how big was this study? Like, who were they looking at?
So they followed over 300 pregnant women between 2018 and 2021. They were all having single pregnancies, and the researchers make sure to exclude anyone with multiple pregnancies, any known developmental issues with the baby, or anyone who was using substances or had certain medical conditions or medications that could have skewed the results.
Okay, so they were really trying to isolate the effects of diet specifically. But how did they actually track what these women were eating? That seems pretty tricky.
Yeah, it is. They used a pretty detailed method. They had these trained dietitians conduct 6 unannounced 24-hour dietary recalls with each woman.
Unannounced. So like they just pop up and say, tell me everything you ate yesterday.
Pretty much, yeah. 3 times in the second trimester and 3
Wow.
times in the third. And they used this specific method called the multi-pass method to make sure they got all the details. And then they used special software to calculate something called the glycemic index of their diets.
The glycemic index, right. That's the measure of how fast different foods cause your blood sugar to rise, right?
Exactly. So like sugary drinks, white bread, those kinds of things would have a higher glycemic index.
Makes sense. So they were looking at the types of foods these women were eating and how those foods might be affecting their blood sugar levels. And you said they were also measuring their body fat.
Yep. They used this high-tech piece of equipment called an air displacement plethysmograph, or BOD-POD for short.
BOD-POD. Okay.
Yeah, sounds a bit sci-fi. But basically, it measures body composition, specifically the percentage of body fat. And they did this twice during each trimester.
Got it. So they're tracking diet, body fat. What else are they looking at?
Well, they also took blood samples from all the participants in both the second and third trimesters.
This was after they had been fasting overnight, right?
Yeah, exactly.
Mm.
And from those blood samples, they were able to calculate something called homeostatic model assessment for insulin resistance, or OMA-IR.
Okay. And that's a measure of like how well the body responds to insulin, which is the hormone that helps regulate blood sugar, right?
Right. So they were getting a picture of both the immediate effects of the diet on blood sugar and the mother's overall metabolic health during pregnancy.
Okay, so that's all the stuff they were measuring on the mom's side. What about the babies? How did they actually assess their emotional states once they were born?
Right. So for that, they waited until the babies were about 6 months old.
Yeah.
And then they used 2 different methods to assess what they called infant negative affect.
Okay, tell me about those methods.
So one method was direct observation. They used something called the still face paradigm.
Interesting. What's that?
Well, it involves the baby interacting with their caregiver as usual, and then all of a sudden the caregiver stops responding and just keeps a neutral face, like a still face.
Oh, wow. I can imagine that would be pretty distressing for a baby.
Yeah, it is designed to be a bit stressful. And then the researchers, who don't know anything about the mom's diet, watch recordings of this interaction and they score the baby's facial expressions, the sounds they make, their body movements, all to see how distressed they get.
Wow, that's pretty intense. So that's one way. What was the other way they assessed the babies?
The other way was through reports from the caregivers themselves. They used a questionnaire called the Infant Behavior Questionnaire Revised, or IBQR.
Oh, okay, so this asks about the baby's typical behavior in everyday life.
Yeah, exactly. And for this study, they focused specifically on the parts of the questionnaire that related to sadness and fear.
Got it. So they got both an objective look at the babies in this kind of controlled, stressful situation, and then the parents' subjective perspective on their baby's everyday emotions. That seems like a pretty thorough approach.
Right. It gives you a more well-rounded picture. So after all that data collection, what did they actually find?
Yeah, that's the big question. What were the main takeaways?
Okay, well, the most interesting finding, I think, was that a higher glycemic index in the mother's diet during the third trimester was significantly associated with increased negative effect in their babies at 6 months old.
So specifically the third trimester.
Yep. And this association was seen both in the researchers' scores from the still face paradigm and in the caregivers' reports of sadness on the questionnaire.
So those last few months of pregnancy really seem to matter when it comes to a baby's developing emotional system.
Exactly. And here's what's even more interesting. They didn't find a significant link between glycemic index in the second trimester and infant negative affect.
Huh. So it seems like there's something about that third trimester that's particularly sensitive.
That's what the researchers think. Now, they did find some other interesting stuff, too.
Oh, like what?
Well, they found that higher insulin resistance in the mothers during the second trimester was linked to higher caregiver-reported fear in their babies at 6 months.
Oh, interesting. So the timing is different for those two findings.
Right. High glycemic index in the third trimester linked to negative affect overall and sadness, and higher insulin resistance in the second trimester linked to fear specifically.
Wow, that's pretty nuanced.
Yeah, it is. But it's important to note that they didn't find any significant association between negative affect and the mother's body fat percentage in either the second or third trimester.
Okay, so body fat wasn't a factor. What about insulin resistance in the third trimester? Did they find any connection there?
Nope, no significant link there either.
Interesting. So it seems like those rapid blood sugar spikes from a high glycemic index diet late in pregnancy might be playing a different role than a mother's more chronic blood sugar regulation issues earlier in pregnancy.
Yeah, that's a good way to put it. And they did some additional analysis, like looking at whether their findings held true even when they accounted for gestational diabetes.
Did it change things?
Nope. The main findings remain significant. And they also looked at something called dietary glycemic load, which takes into account both how quickly foods raise blood sugar and the amount eaten. And that wasn't significantly linked to negative affect in the third trimester.
So it really seems to be about the quality of the carbs, how quickly they spike blood sugar, rather than just the overall quantity.
Right. So those were the key findings. Now, what do you think are the big implications of this research, especially for expectant parents out there?
Well, I mean, it seems like the biggest takeaway is that the third trimester might be a really critical time for mothers to pay attention to what they're eating, especially when it comes to their baby's future emotional health.
I agree. It suggests that making dietary changes in those last few months of pregnancy, specifically focusing on lowering the glycemic index of the diet, could be a really effective way to support healthy emotional development in infants.
Yeah, so it's not necessarily about overhauling your entire diet from the moment you get pregnant, but maybe just being more mindful of those carbohydrate choices in those later stages.
Right. And it also suggests that this is something that can be modified, right? Like it's not set in stone. We can potentially intervene and make changes that could have a positive impact.
That's a good point. So it's not just about identifying a risk factor. It's about identifying something we can potentially do something about.
Exactly. And the researchers also pointed out that this ties into the need for better access to information and support around healthy eating during pregnancy.
Yeah, like making sure expectant moms have the resources and knowledge they need to make informed choices.
Right. And tools like that, My Pregnancy Plate model, developed by Oregon Health and Science University, can be really helpful for that. It emphasizes balance, variety, and moderation in pregnancy nutrition.
Right, focusing on those whole unprocessed foods that tend to have a lower glycemic index.
Exactly. So ultimately, this research underscores the idea that what happens during pregnancy can have a lasting impact, maybe even across generations. Supporting a healthy pregnancy through good nutrition isn't just about the immediate well-being of the mother and baby. It could also be shaping the child's health trajectory for years to come.
It's amazing to think about that kind of long-term influence. But of course, as with any research study, it's important to be aware of the limitations, right? Like what don't we know yet and what needs further investigation.
Absolutely. It's crucial to keep those limitations in mind. One thing the researchers themselves pointed out was that the effects they observed were relatively small. So to really confirm these findings, we need larger studies with more participants.
So it's a promising start, but more research is needed to solidify the connection.
Right. And another important thing to remember is that this study shows an association, a correlation, but it doesn't definitively prove causation.
Classic correlation versus causation issue. Just because two things are related doesn't mean one causes the other.
Exactly. There could be other factors at play that we don't fully understand yet.
Right. So what else did the researchers say about limitations? What are some of the things they highlighted for future research?
Well, one thing they mentioned was the need to look at the long-term effects of these findings. Like, what about the baby's diet after they're born? Does that play a role? Could a healthy diet in infancy and childhood help to offset any potential negative effects from the mother's third trimester diet?
Yeah, that makes sense. It's not just about the prenatal environment, it's about what happens after the baby is born, too.
Right. They also talked about how using continuous glucose monitoring during pregnancy could give them a much more detailed picture of blood sugar fluctuations than just relying on those occasional blood tests and dietary recalls.
Yeah, I can see how those continuous monitors would provide a lot more information.
And they also mentioned that relying on self-reported dietary intake can be tricky. People might not remember exactly what they ate, or they might not report everything accurately.
Yeah, that's true. It's tough to keep track of every single thing you eat over the course of a day.
Exactly. So while this study offers some really valuable insights, it also points to a lot of areas for future research to build upon.
Right. It's an important step forward, but it's definitely not the final word. Now, what about the experts who were involved in the study? What did they have to say about these findings?
Well, they seem pretty excited about the potential implications of their work. For example, Dr. Elizabeth Wood, the lead author, talked about how these findings highlight an opportunity to improve nutrition during pregnancy by giving women more specific dietary guidance.
So, like practical advice they can actually use.
Exactly. And Dr. Jamie Lowe, who's a maternal fetal medicine specialist at OHSU, pointed out that since prenatal care often starts after the first trimester, there's still a window of opportunity to offer dietary recommendations that could benefit the baby's emotional development.
That's encouraging. So even if you haven't made dietary changes right from the beginning, it's not too late.
Right. And Dr. Eleanor Sullivan, who is a professor of psychiatry and behavioral neuroscience and one of the senior researchers on the study, really emphasized the potential for these types of interventions during pregnancy to shape the health of future generations.
Well, the idea of intergenerational impact is pretty powerful. So what was the expert thinking on why the third trimester seems to be so critical when it comes to the mother's dietary glycemic index?
Well, they think it might have something to do with the fact that brain development is happening so rapidly during that time. The brain is forming all those connections between neurons, and they think that this rapid growth might make the developing brain especially vulnerable to fluctuations in blood sugar.
Yeah, that makes sense. A period of rapid development would likely be more sensitive to environmental influences.
Right. And they also pointed out that insulin resistance, which is more of a long-term blood sugar control issue, is different from dietary glycemic index, which reflects those immediate spikes in glucose after eating.
Right, so two different things.
And their theory is that those frequent, rapid increases in blood sugar from a high glycemic index diet might create a less stable environment for the developing brain, even if the mother doesn't have any underlying insulin resistance.
So it's not just about the overall blood sugar levels, it's about those peaks and valleys that might be disrupting the baby's developing brain.
Exactly. So as we wrap up this deep dive, what do you think are the key takeaways for our listeners?
Well, I think the main message is that if you're pregnant or planning to become pregnant, it's worth thinking about the impact of your food choices, especially as you head into that third trimester. It's not about being on a super strict diet, but it is about being mindful of the types of carbohydrates you're eating and maybe focusing on those slower digesting carbs, like fruits, vegetables, beans, nuts, whole grains, rather than loading up on sugary drinks, white bread, and processed snacks.
I totally agree. And there are some great resources out there to help you make those choices. Like we mentioned, the My Pregnancy Plate from OHSU is a great one. But most importantly, talk to your doctor or a registered dietitian. They can give you personalized advice based on your individual needs and health history.
Yeah, having that knowledge and support can really empower you to make the best choices for you and your baby.
Absolutely. And finally, let's leave our listeners with this thought. If something as seemingly simple as how quickly your food raises your blood sugar in the third trimester can have an impact on your baby's temperament, what other subtle environmental factors during pregnancy might we be overlooking? What else might be shaping a child's long-term health and development that we're only just beginning to understand? It's pretty mind-blowing when you think about it.
It really is. And it just highlights how crucial that prenatal period is and how much we still have to learn about its long-lasting effects. Thanks for joining us for this deep dive. We'll be back next time with another fascinating topic from the world of research.
See you then.
Thanks for tuning in to the Health Headliner podcast by Digital. Like and subscribe for more health news and breakthroughs. Stay healthy and informed. See you next time.